Pediatric Emergency Medicine Fellowship will offer the trainee the experience and training to be able to treat all patients from birth to adolescence and early adulthood.
You'll get the opportunity to treat and care for this patient population of Long Island that is very diverse and thankful and appreciative and just very rewarding population to be treating.
We are under the Pediatrics department, and we also work with the emergency department as well. We're very close with them too. So I think that's good because we do have an emergency medicine program here. It's very strong, and I think that's also good training as well with the pediatric department.
Yes.
We have pediatric trained nurses that are just specifically for us, which I think is really helpful. And I think they really make our job easier and make learning easier too for the residents and our future fellows.
You'll get the opportunity to be teaching and working alongside residents of different programs, including pediatrics, emergency medicine, psychiatry, along with undergraduate students in medicine, paramedics, nursing, and physician's assistants.
Exactly. You can do it two different ways. You can actually...
I draw on my team as well as all of the other faculty within the department.
Here at Stony Brook, it feels very much more than just a hospital treating patients.
I like the people. You know, all the faculty in our division and in our department are great to work with.
Anywhere from our clerks to our nurses to our attending physicians to the residents we work with, we work very close with them, and it really does feel like a family on our shift and very team-oriented, I would say.
That extends to the way that we educate our residents, the way that we interact with all of our colleagues and our peers, and then the way that ultimately we treat our patients.
Everyone, then we can go back.
On some days, the PEM physician will be treating merely urgent care type patients, but on other days we'll have very, very ill and injured children alongside others.
Both of these different experiences kind of what defines PEM. You know, you never know what you're going to see, what you're going to treat, but we want to be ready for it every day.
We see the most sick, injured children and adolescents in the area, and we receive transports from other community centers and other hospitals on patients that they cannot handle because their injuries are too severe.
We have 2 PEM providers, 12 hours a day, every day, and we also have a PEM Pediatric Emergency Medicine trained provider attending all hours of the day. You are always working with, no matter what, a Pediatric Emergency Medicine trained provider. And I do love my shifts when there's another PEM attending with me because we could bounce ideas off of each other and we actually learn from each other a lot. So I think that's something really important because I think not all programs have that.
Yeah, so we are going to be able to provide an environment for our Pediatric Emergency Medicine Fellows to thrive in.
Every rotation will be done in Stony Brook, so there's no commuting. You just come to the hospital and you do your shift, which I think is really important with the cost of living and everything like that, that you don't have to go get an apartment, you just come straight here.
I think one thing that also sets this program apart is the ability for our trainees to help and shape the program.
I know we are a newer program, but I think that's good because we'll be able to learn and have fellows come in and help us mold our program.
They will have the effect of helping us hone both the educational and clinical program and give us feedback with which to move forward.
So, how are you doing today?
I really feel like this is the kind of place where you can touch the lives of our most vulnerable patients and their families.
Our PEM program will really have a great work-life balance. That's what we all are gearing towards. I think us personally, we like a work-life balance, and I think that's what we will implement with our future fellows in the program.
Ultimately, we want to be able to provide a training experience that will help prepare fellows to be ready to take on anything.